চেন্নাই অ্যাপোলো 42 ইয়ার্স অলরেডি কমপ্লিট করে ফেলেছি। এই 42 ইয়ার্সের যেমন নিউ ইনভেনশন, নিউ টেকনোলজি, ডক্টরস এক্সপার্টাইজ, এইভাবে অনেকভাবে পশ্চিমবঙ্গ তথা ইন্ডিয়া ওয়ার্ল্ড ব্যাপী সব মানুষকে আমরা সেই চিকিৎসা পরিষেবা দিয়ে আসছি। আজকে আমাদের সাথেই বিশিষ্ট চিকিৎসক অ্যাপোলো হসপিটাল চেন্নাইয়ের ডক্টর J.K.A. জামিল, MRCS, FRCS ইডেনবার্গ জার্ন, MSc, CCT, FACCS, FICS, and senior consultant surgical gastroenterologist, laparoscopic and robotic surgery.
Robotic surgery is a new technique that has come up in the field of surgery, the field of minimal access surgery. Just like how it has its applications in many areas of surgery, there is a huge application of robotic surgery in the field of gastrointestinal surgery as well, starting from surgeries for hernias, to surgeries for gallstones, to surgeries for benign gastrointestinal problems, and surgeries for gastrointestinal cancers. Robotic surgery has got a place in all of them, and it is fast evolving. Already a lot of research happening about getting artificial intelligence incorporated into medicine and surgery. I'm a surgeon talking about surgery and answering Shantanu's question. I very much feel in about 5 to 10 years' time, artificial intelligence will get incorporated big time into the robotic systems. And the robotic systems are geared up and well suited to have these fancy technology incorporated into them. I doubt if artificial intelligence is going to be incorporated in any other aspect of surgery. I mean, for example, laparoscopic or open. If at all it was going to get incorporated, it is going to be in the robotic systems. And when that comes in, it's going to be interesting. We'll have to wait and see. It's very difficult for me to predict how it will be.
No.
There are many things that that are being envisaged. The artificial intelligence getting built into the robotic system, and the robotic arm beginning to do a job at the press of a button. But again, the surgeon has to press the button, right? It doesn't do things on its own. But then it does it precisely the way it has been trained to do. We'll wait and see. We'll cross the bridge when we get there. I mean, certainly laparoscopic surgery is cheaper than robotic surgery. There is no doubt about it at this point in time. But like any other technology, when it first comes, it can be expensive, and as time goes on, and with perhaps increase in competition among the various companies that offer the technology, the costs will come down, and we can only hope that over a period of time the cost comes down.
Even nowadays, patients are wanted to get back from their disease early, so that's why acceptability of the robotic surgery, it is much more higher than the laparoscopic surgery nowadays. And doctor has said that there is a lymph node collection from the laparoscopy. That terminology also explaining by the doctor to the patient, so that patient also will get the happy that okay, that thing is this very smoothly happening by the robotic, so that patient also acceptable. Okay, we'll go for the robotic surgery.
So in as far as my field is concerned, GI surgery is concerned, there are some operations where currently there is no scientific evidence to say that a robotic surgery is superior to laparoscopic surgery, but there are many operations where there are definite benefits of robotic surgery over laparoscopic surgery. But when it comes to laparoscopy and robotic put together in one bucket as minimal access surgery, and comparing it with open surgery, almost all the operations inside the gastrointestinal surgery, gastrointestinal system have been compared, and the 99.9% of them, the opinion is that minimal access surgery is much better when it comes to postoperative pain, discomfort, early return to work, as Narayan said, quickly getting out of the hospital, and so on and so forth. There's no doubt about that.
Yes.
Say if someone has a problem in the abdomen, inside the abdominal cavity, say a stomach tumor or a colon cancer or something of that variety, traditionally surgeons have been doing what is called an open approach, open surgery, which basically means cutting open the tummy and getting the hands into the abdomen and identifying the cancer, removing it, and completing the job. Some 4 or 5 decades ago, early 80s is when the concept of minimal access surgery came in, and that is performing the same operation by making holes rather than making a cut. And by the way, minimal access surgery or minimally invasive surgery is a broad term. It can be applied to any part of the body. It can be applied to the chest, it can be applied to the joints, to the brain. But I'm a GI surgeon and we are talking about abdominal problems here. So we are confining ourselves to minimal access surgery to the abdomen. And that is what laparoscopic surgery means, minimal access surgery to the abdomen. So the same operation from mid 80s onwards, and certainly in India from early 90s onwards, many operations surgeons began to do them by the minimal access approach or the laparoscopic approach. The operation done inside is exactly the same. Whether it's removal of gallbladder or repair of hernia or removal of a stomach cancer or a rectal cancer, the job done inside is exactly the same. It is just the route that is different. Earlier it was an open approach. Now it is same operation doing holes. A few years passed, perhaps a couple of decades passed, and then another evolution in the field of minimal access surgery came up, and that is called robotic surgery. So basically, both robotic surgery and laparoscopic surgery can be termed as minimal access surgery. So what is the difference? With laparoscopic surgery, the surgeon stood next to the patient and he was using long, slender instruments to perform the operation. With robotic surgery, the surgeon is sat in the robotic console, which is usually about 10 feet from the patient, and the robotic instruments are introduced into the patient, and the robotic instruments are used to perform the operation, but every movement of that robotic instrument is controlled by the surgeon sat in the surgeon console. So that is robotic surgery, right? There are so many things that we can talk about. I don't know how much time we have here, but if we can go to the second part of your question.
Benefit of the robotic surgery.
Sorry, if we can just go one by one. So there was a second part of the same question that you asked, which is the benefit. So basically, we are talking about benefit of robotic surgery over laparoscopic surgery, right? We are not talking about the benefit of minimal access surgery over open surgery, because that discussion has already happened. Everybody knows with minimal access surgery there is less pain. With minimal access surgery there is less wound-related problems and so on. Now, within the field of minimal access, there's laparoscopic and robotic. And what is the difference between these two? That was your question, if I have understood it right. First thing, with robotic surgery, we have a better visualization of the problem. The camera systems that come with the robotic systems are very high-tech. It's better visualization, better magnified. We are able to see the structures inside the abdomen about 10 to 14 times magnified. and we get a kind of a three-dimensional effect as well. So it is as if I'm sitting next to the liver. So if I'm operating a patient with a with a stomach cancer, it is as if I'm sitting next to the stomach and doing it there. So I'm able to see better. So by seeing better, I am able to dissect in a more precise fashion. So when you see things better, you're able to do things better, right? So you're able to dissect in a more precise fashion. And because the precision is better than conventional laparoscopic surgery, the blood loss is less. The recovery, the post-operative pain can also be less. The recovery is faster, and that's in general terms. Specific to cancers, there have been studies which have proven that with robotic surgery, due to the increased precision and increased visualization, the lymph node harvest is higher. So, perhaps you are not familiar with the word lymph node. Lymph nodes are small structures that are present in all of us. They're present around, big organs, major organs, and when there is a cancer in an organ, the cancer spreads to the adjacent lymph node. So, if there is a cancer in the stomach, it will, before it goes to different parts of the body, it tends to go to the lymph nodes around. And when we do an operation for cancer, we have to not only remove the cancer, the organ, but also the lymph nodes around. With robotic surgery, we are able to harvest more lymph nodes than with laparoscopic, and that has been proven. I mean, that is, the studies have shown that. So, and that's definitely an advantage when it comes to cancer care. The second advantage, in some cancers, it has been shown that the margin clearance is better. So if there is a cancer here, you're supposed to remove all around, and this is called the margin. And the higher the margin clearance, the better it is for the patient, because there are less chances of cancer recurrence when the margin clearance is better. And that is shown with robotic surgery. There's so many things that we can talk about, and we do discuss about these things in scientific circles.